Hey, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and today, you can't tell from this graphic, but the topic is going to be compromised cases. And I know I have a ton of content on compromised cases already, so before you even listen to this video, be sure you've listened to all my other videos on compromised or surgical cases. You can find those videos in my YouTube channel, Straightsmile Solutions. If you scroll over to the top bar, look for the little magnifying glass, you can put in keyword compromised, and everything on that will come up. The other video videos I want you to watch before you watch this one, because we're going to assume you've already watched them. This is going to be a much more advanced high-level video. It's going to be everything on OMT, letter O, letter M, letter T. So that's oral myofunctional therapy, and that is an integral part of any cases that are compromised. It is not new, but it's definitely taking off, and you're not going to understand anything I say in this video unless you've watched all my videos on OMT, okay? So again, just a quick recap. What's a compromised case? A compromised case is a surgical case that should, someone's calling me at 5 in the morning, that's not cool. Compromised case that should probably, maybe if it was 10 years ago or 15 years ago or 20 years ago, we would have said this is 100% a jaw surgery case. It can only be fixed by jaw surgery or some type of surgical device because the bones grew in the wrong direction. Why did the bones grow in the wrong direction? Well, a component of this is often genetic, but a lot of it is also functional matrix theory or environmental. Again, anything I'm saying here, if it does not make sense, I already have YouTube videos about all this, so you need to watch those videos first. So anytime somebody grows the wrong direction, it's partly genetic usually, there's a component, and there's part environmental. What's the environmental component? Well, that's the part you could control, can control, and should have controlled. It starts often as babies when maybe there's a habit, there's thumb sucking, passy sucking. Maybe they just have an airway, a nasal airway just wasn't formed properly, so they're mouth breathing. And this sequelae causes jaws to often grow in the wrong direction. The most common that you're gonna see sequelae is gonna be that kind of long face, the backwards and downward grower, the kind of anterior open bite, the mouth breathing that happens. Everything happens because there's an equal and opposite reaction. So something as simple as just starting thumb sucking, starting pacifier, starting with a small habit as a baby is gonna spiral out of control if it's not put under control when the child is small. Easy to fix when the child's 2, 3, 4, 5, 6, 7. But if you wait too long, faces are going to grow in the wrong direction. And there might not even be a habit that the parents know about. There can be a lot of habits that parents know nothing about. They either happen at night or they're subclinically evident. They're ones that we would see as a provider, but we can't always see them when you're only in for 10 or 15 minutes. I always like to say that when I went to Disney World with my kids the first time, and my kids are quite trained on seeing mouth breathing habits and all kinds of subclinical habits, tongue thrusting habits. They can see them across the theme park, and we'd be like, mouth breather, tongue thruster. Habits are everywhere, and parents will swear up and down to their grave there is no habit. They don't know how to screen for a habit. They only know if they see thumb sucking in front of them. Also, thumb sucking can happen so parents will not know. Kids can be very covert. I can look at a patient, like I said, 30 feet across the way and say there's a habit. And that's where OMT comes in. I might not know exactly what the habit, usually it's a lot of different habits. And habits can also be caused because, like I said, there might be some type of anatomy issues, either in the nose or with the tongue, or where the fascia is connected to the tongue that prevents the child from being able to breathe properly. If they're not able to breathe properly, they're going to breathe through their mouth all day long, all night long. Or maybe they can focus on nasal breathing during the day, but they're doing it at night. If they're doing it at night, they're gonna grow the wrong direction. Okay, now, so these things have happened. I'm hoping you're catching these in the kiddos at 2, 3, 4, 5, 6, 7, and not waiting until they're teenagers and almost done growing or done growing. If we're waiting until they're teenagers, this just became extremely difficult to fix. It may not even be possible to fix. So now we cannot remodel or reshape the face because the child is done growing. They have finished puberty. So now it's a compromised case. And that is why we must, especially in girls, we must find these cases before age 8 and fix them, okay? And to fix them, the first thing we do is that we find the source of the airway issue or the habit, and we eliminate that first. That could be something that you could do as a doctor, but often you need to involve an OMT in this because it's a lot more complicated than you know. And even if you think you did and the parents think you did, I still strongly recommend that you get the OMT involved, because they are trained specifically to look for itty bitty little signs. Now, if you've watched all the rest of my OMT videos, which I'm assuming you have because I told you to before you watch this lecture, you'll know that I did not even know I have a habit, and I'm an orthodontist with 20 years experience until I went through the OMT experience just as a mock-up, because I've been telling doctors to go. And I don't have a long face, okay? So you see my face, I look pretty normal. But I had subclinical habits that were affecting my life and my bite and my airway in ways I didn't even know. Blew my mind. So I ended up going through, I put my money where my mouth was, and I went through OMT therapy, and it changed my life. I didn't even know my life needed changing. That's the funny thing, in a better way. Better breathe, better sleep, better talk, better speech. It was total, and it wasn't just OMT. If you watch the rest of my videos, I also did cervical chiropractic therapy was part of it. That was part of the prescription that I was given, as well as tongue release. Life-changing. Would totally do it again. So anyways, that is where I can confidently tell you, you guys do not know if your patient has a habit. If you're a parent listening to this, you don't know if your child has a habit. So if you're seeing funny growth or seeing funny things, the first thing you want to do is go to that OMT and get that functional assessment. Now, a lot of them will do a light screening just from photos. No, you can't tell from just photos. They have to do a full functional assessment. That means they're watching in real time, either in person or virtually. And there are quite a few OMTs that have virtual practices that will service all the states. There's no individual state licensure for this. And that's how I did mine. I didn't do it in person, and it worked out fine. Okay, so get the functional assessment. Cost point is usually, I would say, $100 to $200. It's about an hour to an hour and a half, the session. And I think it's even better, if you're considering this for your patient, to have the dentist, if possible, on the session, because this will be an extreme learning experience for you. This is how you're going to learn, because time and time again, I get these doctors that are submitting these compromised cases to me, and I'm like, this is a jaw surgery case. And it happens probably every week, twice a week, 3 times a week. And I'm like, did you get an OMT assessment? They're like, yeah, they said they have no habits. I said, let me see the report. I look at the report, and either they didn't get the assessment, it was just like photos, and that's not an assessment. A functional assessment is like, it should be a full write-up, several pages of what every single point of what the OMT checks. Or the parents lied. So that's why we need the report. Remember, if you're taking these cases and you're taking the parent's word that they've had an OMT functional assessment and the patient is negative, this is your license. You need to get it in writing. You need the OMT to sign off saying that there are no airway issues, there are no functional issues. You may proceed with orthodontic treatment. This is critical that you have that report signed by the oral myofunctional therapist. They have a license, They have responsibility. And if they're signing off and they've gone through all the steps, yes, there is an OMT screening form that I give you guys. And I didn't make it. It's called the fairest evaluation. You can either get it from me, you can probably find it online. That's a nice way for you to screen in office for things. But if the damage is clearly already done in this patient, you need to find out exactly what's going on. Then the OMT is going to prescribe either a surgical procedure, they might refer to ear, nose, and throat for surgery, or they might be able to just like physical therapy, they'll do oral myofunctional therapy. They might also, to eliminate the habit or retrain part of the musculature, or they might send to cervical chiro, or a combination of all 4. So those are the different steps. And I want to go ahead and explain the why behind it. So many of you are saying, it's okay. The parents are fine with it. You do not, in kids under age 18, do compromised cases. No compromised cases. You only do things correct. Why? Because it's a kid under age 18. They can't give consent, okay? Yeah, the parents can, but I've seen it happen where the kid's over 18 and now they're like, you wrecked my bite. You made things worse, because that's what's going to happen. Most likely, if you take these cases and just proceed without getting rid of the habit, you're going to make things worse. You're going to make their function worse, their ability to eat and chew and breathe worse. You might make their sleep worse. You might make that's going to affect their daily activities. You're basically going to cause damage to this child by trying to give them straight teeth. You're going to lose your license for that. You will lose your license for that, because you didn't do things the proper way. And I'm sorry to be a hard butt on this, but that's how it is. Because I've been on the other side of this, where people would come to me for a second opinion. It's like, yeah, they didn't do an OMT. What? They didn't do jaw surgery. What? they just tried to straighten their teeth. Can't do that. Now, adults are a different story. In an adult who's over 18, you can do compromise. I mean, this is how do you sleep. This is your personal ethics. I might be a little more, what I might be willing to do is not what another orthodontist will do. So on the flip side, if you're over 18 and you've already had damage done on your face, be it genetics or functional matrix theory or a compromise of both, you've gone to the OMT, you have your functional assessment, you've had your habits eliminated, or you have a signature from the OMT saying that you have no habits. They've gone through all those points. It should be a multi-page document. Damage has already been done, not much you can do. You don't want jaw surgery. I still strongly recommend, you guys, that you send every single one of these patients to the orthodontist just to get evaluated for jaw surgery, because you guys aren't able to do that. Because sometimes it's free, okay? And sometimes it's not as bad as they think. And sometimes it's really easy. And sometimes it's gonna make their life better. They're gonna feel better. And if you just start straightening teeth, to make a compromised outcome or pulling out teeth, you've now handicapped them and they can't ever get that surgery later because you moved things in the wrong direction. And now it may not be covered by insurance, or now you've made them worse. And again, lawsuit. So that's why you have to tick your boxes. OMT, check, make sure all the habits out of the way. Cover the whole risks, benefits, and alternatives portion of the situation. And make sure you've sent your patient to ortho and had them worked up for jaw surgery. If the ortho is sketchy and the ortho wants to pull out teeth and do compromise, okay, they might poach your patient, sorry. But that's their license, it's not your license. Remember, you have to cover risks, benefits, and alternatives. Alternatives include the jaw surgery. And unless you can explain it and the whole procedure, the benefits, the costs, and everything, you haven't covered that component of RBA. And I'm very passionate about that just because I have a Facebook facing group, a Facebook group, and this is like one of the top 10 things that people get in trouble for, where they're pissed and they will get lawyers involved. You have to do it the way I'm saying, okay? You have to, let alone in a kid, in a teenager. So that's pretty much how it works. You get the habits out of the way, you go to the ortho, get the jaw surgery explained. If they still want to do compromised, you have to find a way to do the case without causing more damage. Like you have to weigh the risks and benefits. So, okay, if we straighten the teeth, what's gonna happen? Well, if we straighten the teeth, and you can't just look at the Invisalign or the Clear Correct plan, because what usually happens in these cases does not happen. I can tell you that much, and any orthodontist will tell you it's totally unpredictable, especially if the habits are there subclinically. Often what will happen in these longer or Openbite cases is that they'll open up more, okay? And now, like I said, they're unable to chew that sandwich. They're unable to say their words properly. At night, they're gonna mouth breathe more, which is gonna affect their overall physiology. It's gonna affect their adrenals, their heart, their blood pressure, their airway. And this is gonna give them a shorter lifespan and a decreased quality of life. And this is gonna be at a risk for your license. So that's why. And same thing if you pull out teeth. Weird things can happen, okay? So just don't take these cases, please. And just again, this is a rant, but it's just happening week to week to week that doctors are just pushing to take cases they shouldn't be taking that should be a jaw surgery case, or need to do the full OMT, chiro, tongue release, ENT workup, that whole quadra thing, in order, the whole myo situation needs to be put out of the way before you even consider aligning teeth. So I want you guys to do things right, because I don't want to see any more damaged patients, and I see damaged patients right and left every day. Mutilated patients that were mutilated by their orthodontist or their dentist. So just a heads up, if I can post this video and if I can help or save one child or one adult from being mutilated because somebody rushed to do their ortho, then this video is worth it. All right, it's 5 a.m. on a Saturday. I had to make this video. Thanks.